Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
I think I like this bumper music. What do you think? You like this one?
Yeah, I do. I like this one. It's snappy.
We're experimenting with bumper music.
Yeah,
Everybody said the last bumper music sounded like the X-Files. Did it?
Yeah.
Did it?
I don't know. I got you. I guess it's because I got used to it. So I guess it's nice to change it up every once in a while.
It is. Hey, I was watching one of those videos of like mistakes in TV shows, and it was the Andy Griffith Show. They were showing all the mistakes of the Andy Griffith Show, and I'm not going to tell you about the mistakes. What I want to tell you is about that town that they lived in Andy Griffith's, right?
Yeah.
So they all knew everybody. You knew the barber knew you. You knew the doctor knew you. You knew the teachers, right, at the children's school. They all knew you by first name. You knew the policeman, who was Andy, right?
That's right.
Andy and Barney, you knew them, right? They all knew you, right? Everybody knew everybody else. And I live in a small town. I mean, this is a small town, right? I think I bumped into your pastor like once. Hey, I know you. And he said, wait a minute, hold on. He didn't know me. So,
Yeah.
Oh, man. I don't have a doctor who can bump into me and say, hey, Larry, how are you anyway? And what's going on with those sniffles?
Right.
I don't have that. But if I lived near Dr. Ken Redcross, I think I would pick him. I think he's the only doctor I know by like first name.
Yeah,
right?
he's pretty amazing.
He's been with us for many years. He's got a new book out. It's called Bond. And I got to find out where he is. He's in like Philadelphia, right?
I think so.
North? The 4 cornerstones of a lasting and caring relationship with your doctor. That's what this is actually about. It's about having a good relationship with your doctor. Dr. Redcross is a board-certified internal medicine physician. He's a contributor to the TV shows The Doctors, Nancy Grace, The Insider, E! Entertainment Television. He's a contributor to AM Ocala Live also.
Yes, he is.
He should
amazing.
mention that in his bio. Good morning, doctor. How are you?
Hey, guys. Good morning. Happy New Year.
Oh, thank you. How are you doing?
I am wonderful and blessed on this Monday morning, so I am doing my best, guys. How are you?
I'm good. And where are you? Again, tell me where you are.
I'm in New York. I'm in New York, actually, the New York area.
I'm moving back to New York, so
I would love that. I'd love to take care of you.
All right, you'll be my doctor. So where will I bump into you? At the Manhattan Mall? Where would I bump into you?
Look, I love shopping, so I'll meet you there. I make house calls, as you know, so I'll be more than happy.
So tell me about the book. Is the book about what I think it's about? About like you and I become buds and you know me just by first name?
No, you hit the nail right on the head, Larry. Look, I've been in practice, gosh, time is flying, almost 20 years now. One of the things that's been important to me are those 4 cornerstones, which is trust, respect, empathy, and communication. And I always say, I feel like a doctor should feel like a member of your family. So I love the Mayberry concept personally because I think that's the way it actually should be within healthcare.
Yeah, I mean, and well, I guess in everything, but in healthcare, maybe even more so. I don't know. I mean, you should know your children's teachers too, but I don't know how important.
Especially nowadays, that's important.
The barber, that's not that important. The barber. But
well, you look good, you feel good, Larry. So that's important.
So what do you do? I mean, so you would bump into me, let's say, in the mall, and you would say, "Gosh, it looks like you put on a few pounds." And I'm going, "Oh, come on," and then and you're going to tell me what to do about it. I mean, is that how the bond would work?
Well, you know it is, but then the other thing with the bond, too, is it allows you to get to a very special place where you can share, sometimes some of the most private and intimate details in counseling and things like that. So sometimes what I do really goes beyond just the healthcare aspect. Lots of times I'm just there as a friend to listen, to give advice and counsel, and make sure along the way we're also keeping them healthy and along with their families as well.
And you also mentor the family members, too, because if a spouse comes in and there's a not-so-good diagnosis, the spouse of that patient has to be told and comforted as well.
No, you're right, Robin. In fact, to be honest, and I don't know if all some of my patients are listening, but that's kind of a great strategy to sometimes go at the husband sometimes and start through the wife and say, you know, I need you to help me out. What's he really eating? Is he really exercising? Is he really doing as he should be that we discussed our last visit?
Oh no! Oh no!
You guys.
Strategy. I had to put it out there.
Oh no! Okay. Robin said you also want to talk about the flu. It's a big deal this year, isn't it?
Yeah, it is, guys. So, look, I'll tell you this. Now, last year's flu looks as if it was a little bit of a stronger strain. That was the H3N2 strain. Now, this one is a strain that we're all kind of familiar with. This was the H1N1 strain called the swine flu. That was back in around 2001 and 2. And so we're starting to see those numbers spike. There in Florida, it is actually looking as if it's widespread as well. But, you know, I just wanted to at least talk about a little bit of a plan of attack, kind of the middle, the beginning, and the end if we do come down with these flu-like symptoms.
The book is like all over the place as far as advice on what we should be doing. Is there anything home remedy-ish that would actually help with the flu?
Well, that's a really good question. So, look, there are some things that, as I always say, guys, are a little bit closer to the earth. Look, when you start coming down with those symptoms, so I should really let everyone know those symptoms are fevers, chills, and body aches, predominantly. Kids are a little bit different. Kids don't tell you they have body aches, but they become a little more listless if they're small. Their appetites change. So if you want to think of some things that are a little different, think about a homeopathic remedy. One is called oscillococcinum. Now, oscillococcinum has been used in Europe for years. I mention it because it's been shown to decrease the severity and the duration of those exact flu-like symptoms, body aches, fevers, and chills. The other thing is oscillococcinum is safe for kids 2 years of age and older, and that's a big deal, and it also doesn't make you sleepy. And that's a big deal also when you talk about a lot of the over-the-counter remedies, that they make us sleepy and tired, and you don't want that for your children either.
I think you mentioned that last time. It's such an odd name. I mean, does it go by a different name, or is that what we look for?
Well, you can look for it under oscillococcinum. A lot of people, especially, it's funny, a lot of my patients who already are familiar with it would just shorten it and call it oscillo, which is probably a lot easier. I'm probably keeping my scientific hat on as I call it oscillococcinum. Right. But the thing is, I just love talking about some things that are different, some things that don't require a prescription pad, because I think we need to try to stay a little bit closer to the earth than maybe we have over the past few years or decades, really.
Okay, what I did last time, and I'm doing it again this time, I'm going to ask the listeners to also do this. If you go to Dr. Redcross's website, a lot of times the stuff he talks about on his visits with us is on the website. So it's drkenredcross.com. Doctor not spelled out. It's the abbreviation Dr. kenredcross.com, and then you'll get to learn about him and some of the other ideas. So my question about that, because I went to the site but I don't see it, is the oscillo, is that on here somewhere?
No, and in fact, it was on there on the bottom, but what I'm doing is I'm updating some more information to share there with them. So I'll have a link that's usually there, but I'm redesigning it. And the good thing is you can also get it at some of the regular drugstores, CVS or Duane Reade, depending on where you are in the U.S.
Oh, okay.
Is it too late to get a flu shot now?
Doctor?
All the way out into May, actually, Robin. So even though you get the flu shot, one thing we should recognize, and I'm glad you asked that, it takes about 2 weeks for the flu vaccine to actually kick in and give you the antibodies you need to fight the flu. So if you're listening today, let's go out and get it, and in a couple of weeks or so, you'll be protected, even though you get a little bit of immunity throughout the process.
Let's talk about the subtitle of the book, The 4 Cornerstones of a Lasting and Caring Relationship with Your Doctor. What are they?
Well, so the important one is that no one can go and see their physician, Larry, and have the sharing of information that's necessary unless you actually trust. And one of those things that's important to me is that you actually trust that your doctor cares, that they have the time. You know, that's one of the challenges we have in healthcare now. On average, you get about 7.5 minutes with your doctor, and that's not enough time to do the things that I think are important, not just the medical diagnosis, but also getting to know your patient, as I say, getting to know your patient's soul. And you can't do that in 7.5 minutes. So you have to do your best to make sure that first cornerstone of trust is actually built. The other thing I talk about is respect, and that's just making sure that the doctor and on the medical community, that we respect the fact that patients have questions, that when patients come in and they have some paperwork that they've printed out from Dr. Google, to not necessarily take that in the bad way. Take that as saying, they just need a little more love, they need a little more information, and that's what we should provide. The other thing that I think is important as a cornerstone is also empathy. Now, this is the part that I really, really love. It kind of fits the way I deliver care when we're actually doing whatever it takes to bring your spirit or your inner being into feeling better, whether that be through prayer, whether that be through meditation, and for me it tends to be a lot through exercise as well. So the empathetic portion is incredibly important in healthcare, and unfortunately I think that that's kind of been a little bit changed when you're running around. And the last cornerstone is that of communication, and communication is important. It's important that when we're talking about, let's say, a diagnosis, that I'm not talking about the left ventricular hypertrophy with those type of words.
Yeah,
we need to communicate and say, Doc, you got to dial it back for me, and I think those things are all important.
So I want to tell you something, and I think you would agree with this, that I think as a patient, you have to trust your doctor, but I think you can also expand that to your doctor's office. You have to trust your doctor's office. And here's why I say that. Because I don't have a regular doctor, but maybe a dozen years ago or so, it's been a long time now, I had some skin cancer on my nose. Okay. Yeah. And the doctor was really, really good and very, very effective at getting rid of it and making me better again.
Good.
But the truth is, he didn't have the best communication skills, or to give him benefit of the doubt, maybe he only had those 7 minutes you're talking about to talk to me. But his staff did. His staff so he was outstanding in what he did, and they were outstanding in explaining what he did. It was a really good office, and I would recommend him and them to anybody. But so I think I would expand trusting your doctor to trusting your doctor's office, and that would include the staff, of course.
Well, I'm glad you mentioned that, and that's important, because one of the things I mentioned as well, sometimes if the relationship isn't exactly what you think, I mentioned going specifically either to the RN, the nurse that's there, or the medical assistant, because they are the ones where you really can get some of the good information and also drive some of the message over to the physician, because sometimes we're running around, Larry, and we don't know
right.
that the patient had something else that they wanted to discuss, or they felt shortchanged time-wise and that sort of thing. So you are so right. I always talk about, it's really a village to take care of patients well. And you're right, a good medical assistant and nurse can really be an important part of that.
And you also have to pay attention to your symptoms, to go back to the flu just for a moment. I didn't realize that lying down was not a good thing for your lungs, that you have to sleep, but you sleep, like in a recliner or something like that.
Well, you know what, Robin, I'm glad you brought that up as well, because I mentioned that one of the things that I don't like patients to do, especially this time of year when they start to get some of these pulmonary symptoms, in other words, the coughing, the secretions, I don't like you to lie flat, and that's for two reasons. The first one is, when you have those secretions, it's important that you're a little bit at an angle, because I find that when patients are lying flat, of course, the cough reflex really kicks into overdrive, and they end up coughing all night and not getting rest, and which then circles back and causes more problem with your immune system. The other thing as well is that I realize that when patients, especially some of my patients who are quite ill and they're reclining like that, it increases their risk for other complications that go along with the flu, like pneumonia. And that's, once again, not managing the secretions, not getting into the doctor soon enough is something else that's important. So as we talk about the flu, I should also point out that the flu is not something that you can go to your doctor and get an antibiotic for. So do not be upset if you leave and you don't have a prescription in hand, because antibiotics are only for bacteria, and the flu is actually a virus.
Good thing to repeat that. Do you know, you mentioned Dr. Google before, and I want to mention Dr. Phil or Oprah or any TV show that might have a guest talking about, the benefits of apple cider vinegar or aloe or anything like that.
Yeah.
So how do you, as a doctor, I mean, you've got 7 minutes, kind of on average. But a lot of times, if the whole world watched the latest Dr. Phil and he had a guest on talking about why we should drink, 4 gallons of green tea.
Yeah.
So how do you handle when you have so many people asking the same question all the time? How does that get handled?
Well, what's funny, Larry, so I do a couple of different things there. So sometimes, as I mentioned Dr. Google before, patients will bring some of their paperwork, and a lot of what they're bringing I'm already kind of familiar with. I try to do a little bit of a deeper dive to find out, hey, what's the problem here? Why did you have to go to Dr. Google and we couldn't talk and discuss these things? Are you afraid of something? The other thing is, when you get some of this stuff from TV coming into us, it's important that I try to do my best to embrace what the patient is saying, but also let them know, hey, look, they don't know you. They don't know your body. They don't know what we're dealing with and so forth. So it's important to kind of embrace it a bit, but then also bring it back to you or them, the patient, directly, so that we can hone in on them a little bit more and not just this kind of catch-all approach.
How does the flu affect people that have diabetes? Is it worse?
Well, I'll tell you this. So anyone who has a suppressed immune system, which can happen in any chronic disease, not just diabetes, but also heart failure and a history of COPD and asthma as well. So we know that those are some of the disease states that when your immune system is kind of beat up and battered a bit can make you or give you an increased risk, as well as being over the age of 65, or let's say those who are elderly, and those on the flip side who are very young, such as the small children. So we know that this is an immune system disease, but last year was tough because the second group that actually was most affected were those in the 40 to 50 years of age, which usually aren't as affected as certain years. Like I said, that's looking like it's reversing again this year, but definitely you're right when you mentioned that in particular, Robin, whether it be diabetes, heart failures, that sort of thing, your immune system is a little bit compromised, which is even more important about you considering getting the flu vaccine this year.
One of the touching things that you have in the book is your story about Sister Beatrice and how she kind of reminded you that, and I'm not trying to put words in your mouth, but like how God had meant for you to be a doctor and to be doing what you're doing. It was a great moment for you, wasn't it?
Gosh, guys, it almost brings tears to my eyes because, you know, one of the things that's interesting is that, look, I've been very fortunate and blessed. I didn't grow up in the church necessarily. I just knew that there was something bigger, whatever people want to call it, whether it's Allah or Buddha or Jesus, whatever that may be. The point is that she reminded me there was something bigger that I was supposed to do for humanity. And to see her walking there and, oh, my gosh, she had a habit on and everything. I said, oh, my gosh. I was almost levitating. I was like, are you kidding me? And so it was just a beautiful moment to me, and it really helped circle back to say, you know, I am thankful for what I'm able to do, and I hope that I'm able to touch souls each and every day that I'm here on this earth. And so, yeah, that was very, very powerful for me, and still is, even to this day, almost, 15 years ago.
Wow. Well, Doctor, you have a phone call. You want to take a phone call?
No, I don't have anybody buzzing in.
Okay, no, I mean, I do. I have a phone call.
Oh,
for you.
Absolutely.
For you, okay. Good morning. You're on the air with Dr. Ken Redcross.
Yes, this is the phone call. Good morning.
Hi, good morning.
You were talking about the flu in the early '90s being that swine flu strain, in which I've gotten flu shots during that period. Would those shots still be effective for me to protect me now from that same strain?
Excellent question, and to answer that question, absolutely. So since that time, what's happened is we've become a little bit smarter on how to battle the swine flu. So when you get your flu vaccine this year, it's covered in the strain. Whether you get the trivalent, which has 3 strains, or the quadrivalent, which has 4 strains, the point is you're protected. So that's a wonderful question. But yes, the swine flu, we're doing better with that as far as this year versus other years.
Thank you.
You're welcome.
All right.
Stay well.
So how do we know what kind of flu strain is out there and what kind of flu shot we should ask for?
Well, I'll tell you, the CDC, we do our best, or I should say the CDC does their best to identify the strains that are what we call more virulent, meaning stronger, and try to do our best to guess what those will be. And I hate to use the word guess because it's a lot more scientific than that, but the flu virus is so smart that it constantly mutates. So the way to think about it is the quadrivalent, which is a 4 strain, typically is reserved for those who are older. The immune system has waned over the years and that sort of thing. So you'll see that a lot. So I don't want everyone to wonder and worry to say, oh my gosh, I need the 3 strain, the 4 strain. You are protected, and no matter what, we know that the flu vaccine actually decreases your severity of symptoms and also decreases your risk for the complications, which tends to be pneumonia as the #1 complication of the flu.
Doctor, we have another phone call.
Sure, please.
Take it. Good morning. You're on the air with Dr. Redcross.
Good morning. My question is regarding children and medicine. When my son takes his son into the doctor and he gets on an antibiotic, why have doctors gotten away from giving them shots of antibiotic? Because my grandson is almost impossible to get medicine into him. I'll hang up and wait for your answer. Thank you.
Wait, hold on. How old is your grandson, right?
12.
Okay, so he's 12. So I'll tell you this. So, I'm sorry, Larry.
Go ahead. Yeah, I have to ride the thing, otherwise you get a bad echo, so I'm sorry.
Oh, okay. So what I was saying is that, it's a little bit easier to get oral medication in. Now, some of the shots that you may be talking about, it really depends on certain disease states. In other words, when you're coming in and you're getting a regular antibiotic, usually it is given orally. For kids, we sometimes, when they're really little, we give it in a liquid form, but not so much through injections per se. Once again, it just kind of depends on what you have a patient coming in for. If a patient is very ill, they can go into the hospital and get IV antibiotics, but very rarely these days are you getting them as far as an injection, depending on the disease state, in the office, and especially during cold and flu season like this.
You also... Oh, sorry.
Just let me make sure if you have a follow-up. Did you have a follow-up?
He just has that tactile taste thing, and it's almost impossible to get medicine in him. It's a battle. And my son even resorted to a suppository at one point.
Oh, okay. Doctor?
Wow. So that definitely sounds like it. And I'm sorry, I couldn't hear a little bit of the diagnosis you said he was dealing with. But if the guys want afterwards, I'd be more than happy to talk to you after the show directly.
Okay. How would she do that?
When I get off with you guys, if you want, please take her number. I'll give her a call right back when we're done.
Okay. Can you call us back after we're off the air, and then you can give Robin your number, and the doctor will call you back?
Okay, thank you.
Okay, thank you.
That's great.
Yeah, and I apologize. I have to ride the levels here. Otherwise, you guys, both of you, will have this horrible feedback. I don't hear it on my end, but everybody tells me so. So I can only kind of let one of you talk at a time.
Look, and that's probably good. That's good etiquette anyway, so that's okay.
Have there been other physicians that have read your book, and have they given you input?
It's funny, physicians, we are a special breed. So, yes, we have. So some are like, Doc, that's great. Then some will say, Doc, that's great. Ken, that's wonderful. But I'm not calling a patient on Sunday to say hello, like I do sometimes. And I get that. My sort of care on the concierge side, it's something I love to do. And not every doc will carve out time. And is it a necessity per se? It's just something that I like. So most of my colleagues have been very happy. And then some will say, well, I'm not going to do these sort of things, or I don't have the time, and so forth. And that's okay, because I think at the end of the day, it's beautiful. We all have something beautiful to kind of sing in the song of keeping everyone healthy.
So the book is called Bond. It's by our guest, Dr. Ken Redcross. I would call him a friend. He's been on our show many, many times. I wanted to ask you your end of it, though. So let's say we bond with you, and I bump into you, and I know you've just gone through something bad, and maybe you don't want me to bring it up. I mean, how does it end? How does it work on your end? If you know what I mean, or you had a car accident and you don't want to talk about it, or something like that,
Oh, you mean as far as on my end?
Yeah, like if I bump into you, I know your life. If we're bonded, you're going to know mine, I'm going to know yours, right?
Oh, yeah. That's funny. That's a good point. And one of the other things that I find is, and I even mentioned this in the book, Larry, I learn so much even from my patients each and every day. And I don't have a problem saying, like, look, yeah, things are a little bit challenging. I have twins at home, and I want to make sure I'm home for them, but I'm traveling. And so I think it's a good sharing of information. It's important for the patients to understand, like, look, I'm human too, and I'm dealing with some of the same challenges. I love sharing the ways that I deal with them, whether it be meditation or exercise for me, hoping that it kind of disseminates over to them as well. But yeah, look, and I have no problem sharing with patients that I'm dealing with some of the same challenges, but it's the way that I deal with them that I try to make sure, no matter what, I believe everything is a positive thing. I don't believe in negativity, and so even if something seems dark or something seems challenging for the moment, I really won't acknowledge that as such, because once again, I don't believe in a negative world or force in that way, and I think that really helps me on my end at least.
Dr. Redcross's website is drkenredcross.com, drkenredcross.com. His newest book is called Bond. I did find it on Amazon. I have a copy here, so if I have one person who would like the copy I have, call me. I'll pick somebody at random. And ma'am, to the lady who just called, please call back Robin after we say goodbye to Dr. Redcross and give Robin your number, and she will tell Dr. Redcross your number, and then he'll call you back. Okay? And doctor, don't go away. Say, Robin, can you get your number? Because I don't know that we have yours.
Okay.
And when we're living in New York, you're my doctor. I'm gonna bump into you in Macy's and then say, hey, how's my bunny?
I like Macy's. Macy's or Bloomingdale's, even if you like. It's you.
All right, we'll be right back. Thank you, doctor.
All right, thank you, guys.
Fox News, I'm Pat O'Neill. President Trump expected to get a warm welcome today when he speaks at the American Farm Bureau Convention marking its 100th anniversary.
The president's trip to New Orleans comes during the partial government shutdown over the president's demand that Congress fund a U.S.-Mexico border wall. Some 800,000 federal employees have been impacted by the shutdown, and on Friday, some missed their first paycheck.
Fox's John Decker. The president, in a tweet today referring to Nancy Pelosi and Chuck Schumer, saying Nancy and crying Chuck can end the shutdown in 15 minutes. At this point, it has become their and the Democrats' fault. At the Critics' Choice Awards last night on the CW network, host Taye Diggs announcing the Best Picture winner.
And the Critics' Choice is Roma.
Roma was considered an underdog among the 14 Best Film nominations. This is Fox News.
Pros in the know start with Lowe's, because at Lowe's, pros can save on the tools and supplies they trust to get the job done. Come in today for our Pro Stock Up and Save event and get 15% off all Lennox tools and accessories. Then save on your next job with 15% off select plumbing and electrical products, including push fittings, supply lines, and shutoff valves. But hurry, these deals are for one day only. So Pro, now that you know, start with